In this vlog, I will discuss capacity and skill related issues that influence the quality of the squat and deadlift movement. I will talk you through the causes and possible solutions for these issues. Here you see two different athletes performing the back squat, both with their own type of movement issue. I'm going to focus on one category of problems for each case. On the left, there is an athlete with a capacity issue, while on the right hand, a skill-related problem can be seen. I will discuss these cases in more depth apart from each other. I will start with the capacity issue. The first thing that stands out from this side view is that this individual struggles to reach a proper deep squat position. A proper deep squat position is when the thighs are parallel with the floor. The movement of the knees in the sagittal plane are quite restricted and a lot of trunk lean is used by this athlete. This increase of trunk lean is displayed by the lines that are drawn over the spine and chin of the athlete. The aim during a back squat is to get the trunk and chin line as far as possible parallel to each other, something which this athlete failed to do so. Also, when we're observing the squat movement from behind, we can see that the ankles are moving into a valgus position during the descent phase of the squat. To investigate the cause of the athlete's movement problem, I let her perform an unloaded squat. It can be seen that when she tries to reach a parallel squat depth, compensatory movements are used to force a way to a proper squat depth. This resulted in an increase of trunk lean and a hip dominant squat. Compared to the loaded squat, an even larger difference between trunk and chin lines occurred, which can be explained by the absence of weight on the shoulders of the athlete. Due to the lack of counterbalance weight, it became harder for the athlete to keep balance and an upright position of the trunk. This can be explained by an immobility of the ankle and can be visualized by elevating the heels. By elevating the heels, the ankle restrictions are removed, and you can clearly see in this footage that an upright position can be held and a parallel squat depth can be reached by the athlete. This gives me the reason to assume this athlete has an ankle mobility issue, thus a capacity-related problem. When comparing the squat with and without elevated heels, we can clearly see the influence of the ankle mobility on the squat pattern. On the right side, the athlete is able to hold the hip much closer to the center line of the body, which results in a more upright position. Meanwhile, on the left side, the athlete is struggling with balance and the squat depth. While elevation of the heels solves the problem in the short term, it doesn't fix the structural problem of limited ankle range of motion. Different things can be done to increase range of motion in the ankles. Foam rolling of the calf muscles can be done to decrease myofascial tension. Passive stretching can help to lengthening the calf muscles. This should be done with a bent knee to stretch the soleus part of the calf. Also, passive stretching shouldn't be done before training. Mobility work could be done as well to work on the passive tissue in the ankles that can restrict the movement in the joint. Moving to the next case, here we have an athlete that has mainly difficulties with the squat as a skill. One of the things that you can see is an inward position of the knees and ankles, which is also called a valgus position. To test if the problem is skill related, I let this athlete perform a couple of reps with an elastic band above her knees. This resulted in an improvement of the knee position during the back squat, caused by a more external rotation in the hip joints. The improvement of the knee position after a squat with an elastic band tells me that this athlete was struggling with the coordination of the limbs, which is a skill-related problem. The explanation of why a mini band or elastic band worked for this athlete is that she was forced to external rotate in her hips, something she forgot to do in the past. The elastic band reminds her to push the knees outwards. This type of feedback is also known as knowledge of result. On the left side you can see an athlete performing a full deadlift with a capacity-related problem, while on the right side an athlete is executing a Romanian deadlift with a skill-related problem. This case contains an individual that has a problem at the start of the full deadlift. The athlete struggles to get the spine in a neutral position. As you can see here, the spine doesn't fit the line. Comparing a high and low hip position at the start of the deadlift, we can see differences in joint angles. The lower hip approach allows the athlete to have more flexed knees and a more extended hip, which creates less tension in the hamstring muscle. This results in less force that is applied on the hip by the hamstring muscle. Therefore, the athlete is able to keep the spine in a neutral position without posterior tilt of the hip. The combination of difference in spine position, joint angles, and hamstring tension between a high and low hip start let me believe that hip mobility is a problem of a flexed spine, which is a capacity-related problem for this athlete. A quick solution for this capacity problem is to start with a lower hip when the athlete wants to perform a full deadlift movement. Although this short-term approach is effective, it is still important for an athlete to be able to operate in a full range of motion during other, more hip-dominant exercises. Therefore, mobility in the hip joint should be increased by making some structural changes. This will decrease the likelihood that the spine gets in an overflexed position. For this athlete, it can be useful to work on its passive mobility of the hamstrings so that the length of the muscles increases, which should be done after training sessions, by the way. Besides that, a foam roller can be used as well during the warm-up to release any tension on the muscle that is created by the myofascial components of the muscle. At last, neural stretching can also help to decrease the inhibition of muscle lengthening. This athlete performs a Romanian deadlift. What stands out is the flexion of the spine during the descent phase of the deadlift. When this athlete performs a hip hinge with a stick parallel to the spine, it can be seen that the athlete has the ability to move through a full range of motion of the hip joint. The stick reminds the athlete to keep the neutral position of the spine. No major restrictions hinder the movement, which tells me that the problem of this athlete isn't a capacity, but a skill-related problem. Using the hip hinge with a stick as a preparation exercise will help the athlete to perform the deadlift with a proper spine position. Any flexion of the spine will create space between the stick and the body of the athlete, which is feedback for the athlete to change its movement strategy. Summarized, we discussed the back squat with a capacity-related problem, the ankle mobility. A quick fix was to elevate the heels, while additional exercises could solve the problem in the long term. During the skill-related problem of the back squat, we could see an athlete that had issues with the knee position. Valgus position occurred during the movement. Elastic bands solved this problem as the athlete was forced to external rotate the knees. The deadlift capacity problem contained an issue with the hamstring muscles. The start position of the hips fixed the posterior tilt of the hips immediately, while additional exercises could help to improve mobility in the hips for the long term. At last, flexion of the spine occurred during a skill-related problem of the deadlift. This could be fixed by performing the hip hinge exercise with stick as preparation for the deadlift. I hope this information was helpful for you, and maybe as well it can be a starting point to openly discuss different movement issues.